Like I was saying before, if you hold your breath long enough, right, eventually at some point you feel like you need to breathe. And when someone is dealing with addiction, when they're dealing with substance abuse, it's become both a psychological and physiological coping mechanism for them.
You're dependent on it. Your body needs it in order to not have DTs or...
Right.
Okay.
So what typically happens first is kind of the psychological part, which is I feel intense feelings. And often it's not the people you think. It's the people that seem the calmest, right? Because they're just a storm inside. They're just not letting you know what's happening. But they're feeling intense feelings of whatever it is. And then they are trying to manage those feelings. And somewhere, either through a little bit of their genetics, their family structure, partying too much in college that kind of lit something inside of them, alcohol, drugs, whatever it is, has become kind of that way of soothing that. And it works for the moment. But that moment doesn't last very long. So pretty soon they're back to those feelings when they sober up, and they need more, and they need it more often. And then you're kind of off to the races. And what starts out as kind of that self-medicating aspect, that self-soothing aspect, then we start tipping over into the physiologic component, because now you are altering your brain chemistry, right? So when that substance is out of your system, your brain notices. And that's where if you hold your breath long enough, when a brain is in that excitatory state, it wants to breathe. And what that looks like is, well, just take a shot, just take a pill, just take something. Sex addiction, food addiction, gambling, things like that. They hit all the same receptors of, we're going to do this activity that will take us out of this very, very uncomfortable feeling we are having right now. So that's kind of the groundwork that I think a partner hopefully can get to a place of understanding with, right? And it isn't their choice. They're trying to hold their breath as long as they can. And it's until they start to kind of address it and build other mechanisms that help them breathe easier, that's when they'll keep coming back to it.
That there's this biological component that it has overridden my nervous system, and that this feels like the only option to help me breathe again.
Exactly. So, if one partner says, hey, I think you're drinking a little too much, and then the other partner is like, I think you're right, and let me slow down. That's probably normal. That's a normal conversation.
Rarely ever happens.
Rarely ever happens. That's something that's probably a little bit more on the normal spectrum. Right. When it gets to a place of your drinking, your drug use, whatever it is ruining the family, and then they are incapable of addressing the behavior, we're into different territory. We're into not choice anymore.
And I think it also creates defensiveness for the partner that may have enabled it to happen. And so that's the part where couples therapy comes in.